let's talk about cervical cancer. So just to remind you folk where a woman's cervix is, well, a woman has a womb where the babies develop and then are ejected out of or born. And the cervix is the bottom of the womb just here. It's at the top of the vagina. See the bottom of the womb? Now that's where you get cervical cancer or abnormal smears. So how do you know you might have cervical cancer or the little precancerous development? Usually it presents with funny bleeding between your periods or strange intermittent bleeding after having sex. The other way, of course, and this is most important, and this is the focus of this talk, is getting cervical smears, and on a regular basis. A lot of money has gone into a free smear program, and so this is a thing that's really made the difference. And years ago, up to 100, maybe more, 200 women would die of cervical cancer every year, but now because of regular screening, it's down to 20. But we want to stop those 20 as well, don't we? So cervical screening is what it's all about. So what happens in a cervical smear? Well, what happens is that you have a pelvic examination, and the examiner, whoever that is, puts a little brush and it circulates around the cervix and scuffs off some of the cells, and they're then sent to the laboratory and they analyse those cells to see whether you might have the little pre-cancer stuff or actual cervical cancer. What they also do is they look for sexually transmitted diseases, bugs, so it's good value. So who does it? Well, the great thing about it is now it's not just doctors, and I think this is what's made the difference in lowering the rates of cervical cancer and cervical abnormalities. And that is, lots of people can do it. You can go to women's health collectives, student health services, local practice nurse clinics, as well as your general practice, where either the practice nurse or the GP will do these smears. So lots of people will do them. You don't have to pay. Some people are free. The important thing is to get the checks done. Now, also very important in the whole abnormal cervical smears, cervical cancer and sexually transmitted diseases is prevention. Number one is safe sex, using condoms if you can. Otherwise, there's a very good and free, for women anyway, vaccine available to help prevent cervical cancer. You see, it seems to be caused by a virus, and they've developed a vaccine which will knock that virus. So that's even going to knock cervical cancer more in the future. You could always argue it's a good idea for blokes to get it, and there's less chance of them getting that virus on their donga and then transmitting it to their girlfriends or whatever. So this is a hard one, fellas, cervical cancer, but it's serious and it affects both men and women.